Welcome to Coping with Kidney Disease. Today we're discussing an important and serious topic: end-stage kidney disease, ESKD. This condition, also known as end-stage renal disease, ESRD, is the final stage of chronic kidney disease where the kidneys can no longer function properly on their own. If you or a loved one is dealing with this condition, it's crucial to understand what it entails and the treatment options available. Before we dive in, please note that the information provided in this video is for educational purposes only and is not intended to replace professional medical advice. Always consult with your healthcare provider for diagnosis and treatment specific to your health condition. Before we proceed, please don't forget to click the thumbs up button, subscribe to our channel and click the bell icon to stay updated with our latest health tips and information. Now, let's dive in. What is end-stage kidney disease? End-stage kidney disease, ESKD, also known as end-stage renal disease, ESRD, is the final stage of chronic kidney disease where the kidneys can no longer perform their essential functions effectively. The primary role of the kidneys is to filter waste products and excess fluids from the blood, maintaining the body's balance of fluids, electrolytes, and waste. When the kidneys fail, these waste products and fluids build up in the body, leading to severe health complications. ESKD is typically diagnosed when kidney function drops to 10 to 15% of its normal capacity. This significant reduction in kidney function means that the kidneys are no longer able to maintain the delicate balance of electrolytes, fluids, and waste products in the body. Without this critical balance, various systems in the body can be affected, leading to life-threatening conditions. The buildup of toxins and excess fluids in the body can cause a range of symptoms, including extreme fatigue, swelling, edema in the legs, ankles, feet or hands, shortness of breath, nausea, vomiting, and changes in urination patterns. These symptoms result from the body's inability to remove waste and regulate fluids effectively. One of the key functions of the kidneys is to regulate blood pressure by controlling the amount of fluid in the bloodstream and the production of hormones that affect blood pressure. In ESKD, this regulation is compromised, often leading to high blood pressure, hypertension, which can further damage the kidneys and exacerbate the condition. At this advanced stage, the kidney's inability to filter blood effectively means that dialysis or a kidney transplant becomes necessary for survival. Dialysis is a treatment that mimics the kidney's filtering function, removing waste products and excess fluids from the blood. There are two main types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, blood is filtered outside the body using a machine. The blood is drawn out, cleaned through a dialyzer, and then returned to the body. Hemodialysis is usually performed at a dialysis center several times a week. Next is peritoneal dialysis. This type of dialysis uses the lining of the abdomen, the peritoneum, as a natural filter. A special solution is introduced into the abdominal cavity, where it absorbs waste products and excess fluids from the blood vessels in the peritoneal lining. The solution is then drained and replaced with fresh solution. Peritoneal dialysis can often be done at home. For some patients, a kidney transplant may be a viable option. A kidney transplant involves surgically placing a healthy kidney from a donor into the body of a person with ESKD. The new kidney takes over the function of filtering blood, allowing the patient to live without the need for dialysis. Transplants can come from living donors, who may be relatives or friends, or from deceased donors. ESKD is a serious condition that requires careful management and ongoing medical care. Treatment plans are tailored to each individual, taking into account their overall health, the underlying cause of kidney failure, and their lifestyle preferences. Now let's dive deeper into the causes of end-stage kidney disease. ESKD arises primarily from chronic conditions that gradually damage the kidneys over time. Understanding these underlying causes is crucial for both prevention and management. One of the leading causes of ESKD is diabetes. High blood sugar levels associated with diabetes can damage the blood vessels in the kidneys, impairing their ability to filter waste effectively. This condition, known as diabetic nephropathy, is a major contributor to kidney failure. Another significant cause is high blood pressure, or hypertension. Chronic hypertension puts increased pressure on the blood vessels, including those in the kidneys, leading to damage and reduced kidney function. In addition to diabetes and hypertension, glomerulonephritis is a key factor in the development of ESKD. This condition involves inflammation of the glomeruli, which are the tiny filtering units within the kidneys. The inflammation can lead to scarring and loss of function, progressively diminishing the kidney's ability to filter waste. Polycystic kidney disease, PKD, is another notable cause. This genetic disorder causes numerous cysts to form in the kidneys, which enlarge over time and cause significant damage, ultimately leading to kidney failure. Chronic kidney infections and obstructions also play a crucial role in the progression to ESKD. Recurrent infections such as chronic pyelonephritis can cause persistent inflammation and scarring, weakening kidney function over time. Similarly, obstructions in the urinary tract, often caused by kidney stones, tumours, or an enlarged prostate, can lead to kidney damage if left untreated. These obstructions can block the flow of urine, causing it to back up into the kidneys and inflict long-term damage. By understanding these causes, individuals and healthcare providers can work together to manage the underlying conditions effectively, slowing the progression of kidney damage and improving outcomes. It's essential to monitor and manage risk factors like blood sugar and blood pressure, seek timely treatment for infections and obstructions, and be aware of genetic conditions that may predispose one to kidney disease. Through proactive management and regular medical checkups, the onset of ESKD can often be delayed or prevented, enhancing the quality of life for those at risk. Now let's explore the symptoms of end-stage kidney disease. One of the most common symptoms is fatigue and weakness, which occur due to the buildup of toxins and the development of anemia. As kidney function declines, the body is less able to produce erythropoietin, a hormone that stimulates red blood cell production, leading to anemia and resulting in feelings of extreme tiredness and weakness. Swelling, or edema, is another prevalent symptom, often observed in the legs, ankles, feet, or hands. This swelling occurs because the kidneys are no longer able to regulate and remove excess fluids from the body, leading to fluid retention. Additionally, shortness of breath can develop if fluid accumulates in the lungs, making it difficult to breathe comfortably. Nausea and vomiting are common symptoms resulting from the accumulation of waste products in the body that the kidneys can no longer filter out effectively. This buildup of toxins can irritate the gastrointestinal tract, leading to persistent nausea and vomiting. Changes in urination patterns are also a hallmark of ESKD. Patients may experience decreased urine output, difficulty urinating, or even complete cessation of urine production as the kidneys lose their filtering capabilities. Persistent itching is another distressing symptom, caused by the buildup of waste products in the blood that can irritate the skin. This itching can be widespread and severe, significantly impacting the quality of life. Furthermore, chest pain may occur if fluid builds up around the lining of the heart, a condition known as pericardial effusion, which can lead to additional complications if not managed promptly. Recognizing these symptoms early and seeking medical attention is crucial for managing ESKD. Timely diagnosis and intervention can help alleviate symptoms, improve quality of life, and slow the progression of the disease. If you or a loved one experiences any of these symptoms, it is important to consult with a healthcare provider to receive appropriate care and support. Understanding how end-stage kidney disease is diagnosed is the next critical step. Diagnosing ESKD involves a comprehensive approach that includes blood and urine tests, imaging studies, and sometimes a kidney biopsy. One of the key diagnostic tools is the glomerular filtration rate, GFR, which measures how well the kidneys are filtering waste from the blood. A GFR below 15 indicates ESKD, highlighting a critical decline in kidney function. Blood tests are another essential component of the diagnostic process. These tests measure levels of creatinine, urea, and other waste products in the blood. Elevated levels of these substances indicate that the kidneys are not effectively removing waste, which is a hallmark of ESKD. Additionally, blood tests can help assess electrolyte levels, such as potassium and phosphorus, which are often imbalanced in individuals with kidney failure. Urine tests are also vital in diagnosing ESKD. These tests can detect abnormalities in protein or blood, which may signify kidney damage. The presence of protein in the urine, proteinuria, often indicates that the kidney's filtering units are damaged and allowing protein to leak into the urine. Similarly, blood in the urine, hematuria, can be a sign of kidney disease or other urinary tract disorders. Imaging tests, such as ultrasounds or CT scans, provide a visual assessment of the kidney's structure and size. These imaging studies can reveal abnormalities such as kidney stones, cysts, or tumours that may be contributing to kidney damage. They also help in assessing the extent of scarring or shrinkage in the kidneys, which are common in chronic kidney disease. In some cases, a kidney biopsy may be necessary to determine the precise cause of kidney damage. During a biopsy, a small tissue sample is taken from the kidney and examined under a microscope. This procedure can provide detailed information about the type and extent of kidney damage, helping to identify specific conditions such as glomerulonephritis or interstitial nephritis. The combination of these diagnostic tools allows healthcare providers to accurately diagnose ESKD, determine its underlying causes, and develop an appropriate treatment plan. Early and accurate diagnosis is essential for managing ESKD effectively and improving patient outcomes. Now let's explore the treatment options for end-stage kidney disease. Managing ESKD involves several approaches, including dialysis, kidney transplantation, lifestyle changes, and medications. Each option aims to replace the lost functions of the kidneys, alleviate symptoms, and improve the quality of life for patients. Dialysis is a life-saving treatment that filters waste products and excess fluids from the blood when the kidneys can no longer do so. Kidney transplant is another treatment option for ESKD. This surgical procedure involves placing a healthy kidney from a donor into the patient's body. The new kidney takes over the function of filtering blood, allowing the patient to live without the need for dialysis. Donor kidneys can come from living donors, who may be relatives or friends, or from deceased donors. A successful kidney transplant can significantly improve the quality of life and increase life expectancy for patients with ESKD. However, patients must take immunosuppressive medications for the rest of their lives to prevent their bodies from rejecting the new kidney. Lifestyle changes and medications are also crucial in managing ESKD. These strategies focus on controlling the factors that can worsen kidney function and managing symptoms. Key lifestyle changes for managing end-stage kidney disease include adhering to a kidney-friendly diet, engaging in regular physical activity, and taking prescribed medications. A kidney-friendly diet limits the intake of sodium, potassium, phosphorus, and protein, which helps reduce the workload on the kidneys and maintain the balance of electrolytes and fluids in the body. Regular exercise is also essential for maintaining overall health, managing blood pressure, and controlling blood sugar levels. In addition to diet and exercise, taking prescribed medications is crucial for managing blood pressure, blood sugar, and cholesterol levels. Medications such as ACE inhibitors, angiotensin II receptor blockers, ARBs, and diuretics can help protect kidney function and reduce the risk of complications. These lifestyle changes, combined with appropriate medical treatments, can help slow the progression of kidney disease, alleviate symptoms, and improve the quality of life for patients with ESKD. Living with end-stage kidney disease means making significant lifestyle adjustments and staying on top of your medical care to manage the condition effectively and maintain a good quality of life. Here are some key tips to consider. First, follow a kidney-friendly diet. This means limiting sodium, potassium, and phosphorus, as these minerals can build up in your body when your kidneys aren't working well. It's also important to manage your protein intake to avoid overloading your kidneys. Working with a dietitian can help you create a meal plan that meets your nutritional needs while protecting your kidneys. Staying properly hydrated is vital, but you'll need to carefully monitor your fluid intake. Follow your healthcare provider's advice on how much to drink each day, as too much fluid can cause swelling and high blood pressure, while too little can lead to dehydration. Monitoring your blood pressure and blood sugar levels is crucial, since high blood pressure and diabetes are leading causes of kidney disease. Regularly check these levels and manage them through medication, diet, and lifestyle changes as advised by your healthcare provider. It's also important to attend regular medical appointments. These checkups allow your healthcare team to monitor your kidney function, adjust your treatment plan as needed, and catch any potential complications early. Seeking emotional support is essential too. Living with ESKD can be challenging, so consider joining support groups or seeking counselling. Connecting with others who understand what you're going through can provide comfort and practical advice. Stay informed about your condition and treatment options and actively participate in your care. Communicate openly with your healthcare team, ask questions, and express any concerns you may have. Lastly, engage in regular physical activity as recommended by your healthcare provider. Exercise can boost your energy levels, strengthen your heart, and help manage other conditions like diabetes and high blood pressure. Finally, consider the importance of mental health. Chronic illnesses can take a toll on your mental and emotional well-being. Activities such as meditation, mindfulness, and hobbies you enjoy can help reduce stress and improve your quality of life. By making these lifestyle adjustments and seeking ongoing medical care, individuals with ESKD can manage their condition more effectively and lead fulfilling lives. Remember, you are not alone. There are resources and support systems available to help you navigate living with end-stage kidney disease. And there you have it, a comprehensive look at end-stage kidney disease. We hope this video has provided valuable insights and practical advice for those affected by end-stage kidney disease. If you found this information helpful, please give us a thumbs up, subscribe to our channel, and click the bell icon so you never miss our latest health tips and updates. If you have any experiences with kidney disease that you'd like to share, please leave a comment below. We'd love to hear from you and continue the conversation. Additionally, consider supporting our channel with a super thanks if you enjoyed this video and want to help us bring more informative content to you. Thank you for watching, and stay healthy and take care.